With their recommendations and the work that we have done with public health experts, we've designed a staged recovery for Michigan. Now, it's important that we remember we have to re-engage like a dial, not a switch that goes on or off, but a dial that we can turn. And we can continue to turn the intensity up if everyone does their part. We have to remember the threat of a second wave is very real, and it's one that I hope we are unanimous in, that none of us wants to see that happen. In the 1918 flu, or the pandemic that is playing out right now around the globe, there are case studies abound that those who resume life as it was, who drop all of the social distancing and the masking, can go right back into a second wave. And that wave can be as deadly or worse than the first, and certainly as economically damaging as the first. And that's why this staged recovery is so critical. We have to continue to move incrementally and measure our data every step of the way. That means continuing to ramp up our testing and our tracing capabilities to isolate when we detect COVID-19 so that we keep this number low and don't get overwhelmed again and have community spread. There are 6 stages to our My Safe Start, and each step forward is contingent on factors relating to the spread of COVID-19 and our ability to detect it, trace, and isolate positive cases. And that's why it's really up to the people of Michigan to do your part so we can keep moving forward. Phase 1 is uncontrolled growth. That's where we were 8 weeks ago. That's where the increasing number of new cases every day begins to overwhelm our health systems. And that's when we start to take serious steps to curtail the spread by stopping education of our kids, for instance, or closing bars, going to a stay-home order. The second stage is persistent spread, where we don't see the exponential growth, but we continue to see high case levels with concern about our healthcare system. The third phase, which is flattening, and that's where we are right now. It's when the epidemic is not increasing at those great rates, and our healthcare system is sufficient to meet current needs. That's where we are right now. So we are in the third phase of this. We've reopened some construction, or all construction. We've reopened manufacturing that will go into effect this coming week and really more into effect the week after. It has strict safety measures, but we will continue to move forward. And in order to stay safe as we re-engage these sectors, we need to continue practicing strict social distancing, wearing face coverings, using safe workplace practices, the state will continue to work on our testing capabilities and tracing capabilities. And in this phase, we can permit outdoor activities with distancing maintained. We know that even in this phase, we are still safer at home. And that's why we'll be extending the order through the 28th, because we are still safer at home. While we can re-engage in more things, we've got to be smart about it. Phase 4, which is where we hope to move next, in short order, depending on how well we all continue to be vigilant, is when we see cases and hospitalizations and deaths are clearly declining. The 5th stage is called containing, and that's when we have continued case and death rate improvements and outbreaks are quickly contained. So if we see a spike somewhere, we're able to trace and test and keep it from a community spread. And the 6th phase, which is the ultimate goal, is post-pandemic, and that is when community spread is not expected to return. That's going to be a while. We just have to be very clear about that. Post-pandemic is when we have a vaccine, or we have some sort of a cure or therapeutic that can cure COVID-19. That's going to take a little while, but the good news is that we are starting to move forward, and you can see kind of what this will look like. So today I've signed an executive order to extend the Safer at Home order until May 28th. We'll be reopening manufacturing work, and as a part of the My Safe Start plan to re-engage the economy. These are the 2 big things in this order. Starting on Monday the 11th, workers in manufacturing can begin phasing into work. So This is a really important moment that I think it's critical that we acknowledge something. Manufacturing is an important part of our economy, there's no question. And as we've done the risk assessment, we feel comfortable that with these safety protocols, we can safely re-engage. And I think for the purpose of perspective, it's important to know that manufacturing is about 19% of our economy. And we've already got 4 to 5% that is already engaged as essential. And so this is a sizable part of our economy, but it is an incremental step. The big three auto suppliers, in agreement with the UAW, will begin phasing in work on the 18th, and they'll be starting at 25% capacity and phasing up from there. This is truly good news for our state. It's a major step forward on our My Safe Start plan to re-engage our economy safely and responsibly. My team and I have been looking at the inherent risk in different sectors of our economy. This is work that was done with Merck and the University of Michigan to help inform how we mitigate risk as we re-engage. My team and I determined that manufacturing has a lower risk score than some other industries, and therefore that's why we start the phase-in on the 11th and the big three on the 18th. We made this decision based on data and recommendations from the expertise that I have cited earlier. Our industrial sector, as I said, accounts for about 19% of our total economy, and that is spearheaded by the automotive sector. As I pointed out, about 5% of this was already at work because they were an essential part of the energy, for instance, energy part of our economy. So, business must do their part to protect workers as we re-engage. We've got to make sure that people are safe in the workplace and when they go home. It's on the individual when they go home, but it's on the employer and the employee when they are at work. Leaders in industry have been working with Merck and my team to develop an array of workplace safety protocols and practices that have been supported by our public health experts. Manufacturing facilities, by example, must conduct a daily entry screening protocol for workers and everyone else who enters the facility. That includes a questionnaire that is covering symptoms and exposure to others with possible COVID-19, together with, if practicable and possible, a temperature screening. These are some of the examples of these protocols. They are not this is not a complete list of all the protocols, but I wanted you to have an opportunity to see what some of the work is that we're doing. They also will be creating dedicated entry points at every facility. They will be suspending entry of non-essential in-person visits, including tours. And they've got to train workers on, among other things, how COVID-19 is transmitted from person to person, what the signs and symptoms are of COVID-19, steps that workers must take to notify the business or operation of signs and symptoms of COVID-19 or suspected or confirmed diagnoses, and the use of personal protection equipment. These facilities must require masks to be worn when workers are not able to consistently maintain 6 feet of separation from others, and consider face shields for those who cannot consistently maintain 6 feet of separation. It's crucial for our businesses to do everything they can to stay clean. Facilities that open under this executive order should disinfect high-touch surfaces, paying special attention to parts, products, and shared equipment, and shut areas of the manufacturing facility for cleaning as necessary if a worker goes home because he or she is sick. Every one of us has to play our part to get this right, so employees and customers alike can have the confidence that they will be safe, so we prevent spread and don't have to dial back, or worse yet, go back to a stay-home order. I know that none of us wants that, so we've all got to keep doing our part. It's crucial that as we begin to re-engage sectors of our economy, our workers know that a business cannot retaliate against them if they stay home. I signed an executive order stating that businesses can't punish a worker who's got to stay home because they are sick or because someone in their household is sick or has COVID-19 symptoms. We need to ensure that employees who are sick have someone, or someone has someone at home who's sick, that they got to stay home. That's what business wants as well. They don't want to get their workplaces infected either. And so we're all in this together. If you're one of the people who is going back to work, we need you to be scrupulous about best practices, both inside the workplace and outside. So neither you nor your family nor your coworkers can get sick. And the order that I signed today requires manufacturing facilities to send potentially exposed individuals home upon identification of a positive case in the facility. Now, I know Michiganders are eager to get back to work, and our businesses are eager to start up again. I am too. But it's crucial that we stay smart. If you think you're experiencing symptoms, go home. Find your nearest test site at michigan.gov/coronavirus test and get tested. One worker carrying this virus can infect 20 more, who can infect thousands more. We must stay smart. Nothing is more important than protecting you and your families. Because COVID-19 is still present in Michigan, even though we're seeing fewer new cases each day, we still have to be vigilant across our state. We have lowered our curve. So let's talk about what could cause us to move backward. We're a couple of slides in, Emily. That's okay. There you go. What could cause us to move backward? Well, every decision that my team and I have made since March 10th has been centered by the need to protect public health. Each has been informed by the best minds in epidemiology, public health, and business. Each has weighed heavily on me personally because I know that they come with a cost. It's not been easy, but it is crucial that we see this through. Letting our guard down now squanders all the hard work that we've put into this date. Abandoning the science and safety measures would expose us to a second wave that could possibly dwarf the one that we've been through and squander our hard work. So as we proceed, all the decisions that we've made are to lower the possibility of that second wave. We will remain nimble. We must. We will monitor data so that we can pull back if we see a spike in cases that could overwhelm our hospitals. We will pull back if it's necessary, although we hope it's not. I'll continue to closely monitor data and receive on-the-ground feedback from our local public health departments and regional healthcare councils. If necessary, we'll dial down and we'll take a step back to the previous phase based on the following factors: a sustained rise in positivity rate, a sustained increase in hospital admissions for COVID-19 like illness, a reduction in hospital capacity threatening surge capabilities, significant outbreak in the region that threatens the health of the region. Remember, this depends on every one of us. We all have a role to play in whether and when we take this next step forward or backward. We're all safer when people stay at home. But when we do go out, we're safer when everyone practices good hygiene. The 3 W's. Wear a mask. Wait 6 feet apart from one another, and wash your hands.